What do you think are the big benefits of Obamacare? And then we'll look at all the bad side also.
Well, the big benefits are that as Obamacare has specified what the minimum standards are that a health insurance policy must provide, the first thing is this sort of a must insure provision where if you go in and you apply to a health insurance company for insurance, they cannot reject you because you have a pre-existing condition. So that's the big thing. The second thing is that if you have insurance, a private health insurance policy, and you get seriously ill, the company cannot rescind your coverage. So there's no longer on the application, they don't ask you, to fill out every illness that you've had in the last 5 years and tell them about every prescription that you've had the last 5 years. They can't use that catch-22 argument to say, well, you lied on your application, so we're taking your insurance away. There is no ability for the insurance company to rescind the policy.
So do you think that's probably why we get a lot of these paid bloggers and entertainers that talk in the lobbyists trying to get the ACA or Obamacare rescinded, or even the Medicare reforms not coming into place?
I don't think that they mind people getting insurance like that. I think a lot of their objection, there are a lot of federal subsidies for low-income families that might not be able to afford their insurance on their own. If the bill's coming in at, say, $300 or $400 a month, they may not be able to afford that. Obamacare does provide subsidies for low-income families. And what a lot of people know is, well, who's going to provide that subsidy? It's the taxpayers. It's those of us that are working for a living. And so it looks like another, income redistribution plan, and that's one of the big objections and why guys like, Rush Limbaugh rail against this system.
Well, but guys like Rush Limbaugh don't talk about that we're already providing that same service either under Medicaid or indigent care at the local emergency room, and that cost is much higher than a rational approach that we're trying to do. I don't believe that Obamacare is perfect. I think there's a lot of holes, there are a lot of mistakes, but it's better than what we have now. Wouldn't you agree? And as a basis of being the Centrist Foundation, we've put out the challenge. Any of these entertainers that are out there, like Rush or whoever, come on, we'll debate you, fact-based. You can't hang up on us because it'll be at a rational place and an objective place.
Yeah, I think overall it's a better system. We're not going to have people dying because they couldn't afford a health insurance policy, or we're not going to have people dying because the health insurance company rejected them because they were already sick when they walked up to apply. Now, there's some caveats that go along with that, and you cannot go and apply for a homeowner's insurance policy for your home 2 days before the hurricane strikes. There's a policy in provision in homeowners policies that they have to be in effect 30 days before the insurance company becomes liable, and it's to prevent the case where somebody would, for instance, not insure their home, and then they see on the news there's a hurricane out in the Gulf of Mexico about to hit Houston, and it's going to be here in 1 week, and they run down there and they apply for insurance, and they want to pay $100 1 month to insure the house, and they want the home insurance company to pay them $150,000 to replace the house. That's not how insurance works. So by the same token that doesn't work for homeowners insurance or property insurance, the same thing cannot work for health insurance. And that's why everybody is being required to carry health insurance or pay a penalty.
And the penalties are very low for the first few years. In fact, I just looked at as a comparison, Medicare. If you're eligible for Medicare, and if you make between $85,000 to $100,000, your monthly payment's only $104. So that takes that subsidy all the way up to $85,000, which is probably very few people make that.
Yeah, the penalty the first year is about
$94.
$95,
right.
Which, in my opinion, is probably too low. I think the penalty in the second and third year rise to about $500 a year. for the second year and $600 a year for the third year, which is starting to get a little bit more reasonable. But if you are going to have a must-insure clause in the insurance policy where you have to insure people even with pre-existing conditions, then you're going to have to tell people you need to carry insurance all the time. Otherwise, there's no way that that system will work, and we could pay the bills with the amount of income we're generating.
Okay, if I'm hearing you right, insurance companies need to make money. And these are private insurance companies. This is not government-run insurance. Medicare, Medicaid are government-run insurance programs, but service providers are private providers, meaning hospitals, private doctors. So there really isn't a government medical system. This is a government, Medicare, Medicaid are government-managed systems. And the Obamacare is really pushing people to private insurance. So why do you think that people are putting in so much negativity if it's not the insurance companies who want to do business? Why do you think the entertainers are doing it? Oh, it's a question that I really don't want to waste time here answering, but I just wanted to put that question out there for people to sit there and say, when you hear these entertainers, morning disc jockeys and stuff talk about, stop and think, who is pulling their string? Who is paying them to talk about this if it's not the insurance companies who want to do business, right? So going back into what you were talking about, outcome-based pricing versus fees for service in our last podcast, if you could kind of talk about that, then we'll look at the issues with Obamacare.
Well, one of the things that Obamacare proposes, this is a system that the government purports to be paid for. So there's going to be some additional expense. So how does it get paid for? Well, part of that could be the penalties that an individual would pay for not having insurance, which would go to the government and not to an insurance company. Part of this is actually considered a savings, actually about $700 billion over about 10 years out of the Medicare system. And where does that savings come from? There is a change in the Medicare system from the current system, which is called fee-for-service. And basically under fee-for-service, every time a doctor runs a test, they get compensated for the cost of running that test. Same thing with the hospitals. If the doctor orders a test, the hospital runs the test.
And they both make money.
They both make money. In the new, what's proposed is this outcome-based pricing. So if you have, let's say, diabetes, a condition that requires ongoing attention, then Medicare will pay a fixed amount to the doctor and the hospital to treat a patient who has diabetes. Now, at that point, the doctor can run 10 tests, or the doctor could run 3 tests, but his income is not going to change. He's paid for treating the condition of diabetes. It doesn't make any difference how many tests he runs.
So that makes the system more productive and efficient, wouldn't you say so?
Theoretically, it should. Doctors and hospitals will not be incented to run more tests than they need to run. If they can treat a condition effectively by running fewer tests, that would optimize their problems. So now that would optimize their profit. So now they are incented to be more efficient and not to just run tests that are not required to generate additional fees.
One thing you don't hear about in the media and in many of these entertainers don't talk about is in the outcome-based payment system, the doctors are given bonuses if they're able to treat and cure the person ahead of schedule, so to speak, to where they run 1 or 2 tests and figure out what's wrong and fix the person, so to speak, rather than continuing to keep that person as a money machine and not fixing the person. So would you agree with that comment?
I agree with the comment, and here's where the controversy and some of the pushback from those on the right. Anytime you go out and you change a system as large and complex as our healthcare system, there's going to be a question, is this going to work? And people are concerned that if we begin to squeeze the pricing that we're willing to pay to cover certain conditions, that this will reduce the quality, potentially reduce the quality of care while we're doing a good job controlling the cost.
Well, yeah, that's a great point. But if you were honest as a public out there to look at the quality of care that we get, is it really the best care that we get, or is it just something that's making money for the hospital, for the doctor? So realistically, we have to look at outcome-based pricing, outcome-based service as not a panacea, but probably a good step towards containing costs. It upsets a lot of doctors. It upsets a lot of unproductive doctors and clinics. As I mentioned before, the folks that take care of me, Medical Memorial Clinic Associates in Houston, Texas, they have made their system so efficient to where the doctor walks in with a computer, he or she has all my information on that laptop. They know instantly what's going on, and they treat me very quickly and efficiently. They use nurse professionals, physician's assistants to support the primary doctor. One thing we have not talked about, and we will talk about in future webcasts probably, is the HMO model versus PPO and other different models. But needless to say, the whole idea is to make the system more productive and more outcome-based and more caring for the